Hello, I'm Dr. Shefali Karkhanis and I'm a practicing diabetes specialist at Thane, Mumbai. Today I'm going to give you an overview of complications of diabetes. We all know that diabetes is basically high blood sugar caused because of imbalance between the supply of the insulin from the body and the demand that the body has about insulin. I am going to talk about complications of diabetes because diabetes is going to affect each and every cell of your body, right from the hair on the top of your head to the nail in the bottom of your feet. So, problem with diabetes is that all of these complications are generally silent. So you do not feel that there is a problem. The complications will develop with time, and it depends upon the duration of diabetes as well as the severity of diabetes. That means the longer that you have diabetes, the more is the risk of you developing complications. Similarly, the higher the control of sugar, the better is your risk for not developing complications. That means if a person is having diabetes for about 10 to 15 years, there's definitely a risk that he will have some other form of complications with him. But if he's been well controlled for all these 10 years, the risk reduces exponentially. On the other hand, if a patient is only diagnosed for the last 3-4 years, but he has a very high sugar or a very high fluctuating sugar, he is more likely to develop complications very soon. Complications can be divided into two parts. One is acute and one is chronic. Acute complications include one, very high blood sugar, which will lead to acidosis, coma-like conditions, and the person has to get hospitalized, be on insulin, etc. Second is low sugar, that is very low sugar, wherein the patient feels he feels dizzy, he feels giddy, he has shivers, he has sweating, he might even land into an unconscious state. The treatment for these two is very simple. If the sugars are very high, take him to a doctor, treat him with insulin, bring down his sugars, correct the acidosis, and everything will be fine. If the patient is having low sugar, before going to the doctor, you can treat it. Just put in some powdered sugar or a paste of powdered sugar inside the mouth, and the patient's blood sugar will slowly start increasing, and he can be then transferred to the hospital. The causes of hypoglycemia are: one, if the patient is taking erratic medications, if the patient is fasting at times, if the patient the dose is not adequate or he's taken multiple doses at a time, or if the patient has just skipped a meal altogether in spite of taking the medications. So any of these conditions, you can get low sugar, and the easiest thing to do is put sugar in the mouth. Do not give water to an unconscious patient because it might cause other complications. Coming to the long-term complications, diabetes will affect major organs which get affected are your eyes, your heart, your kidney, your nerves, as well as your blood vessels. In your eyes, there's something called as retina. Retina is like the brain of the eye, and there will be small bleeding spots in the retina, but the vision is 100% normal. So you don't realize that there are spots inside. These aneurysms can be these microhemorrhages can be diagnosed at an early stage with an eye doctor, and if it is diagnosed, it can be treated and brought to normal immediately. In the second stage, these microhemorrhages become larger in size and there is bleeding inside your eye, and that is when you will have vision disturbances. But by then, only oral medications is not going to help you. So depending upon the damage, you might require injections, lasers, other procedures, etc. The same thing happens with your heart. Your heart, the blood vessels to your heart gets affected because of diabetes, and this will reduce the amount of blood supply to your heart, making you more prone to develop heart attacks. In diabetics, the heart attacks are many times silent, so there might not be a lot of chest pain, but there might be vague symptoms like small pain in the back or discomfort or heaviness, or you just might feel breathless, especially on walking, especially on lying down. So all of these things will need to be addressed, and you have to undergo a treadmill test regularly to ensure that your heart is fine. The second thing that happens in the heart is the pumping capacity comes down. So your heart does not pump as well as it used to. Again, this can be diagnosed with a simple non-invasive technique like an echo, which can be done with any cardiologist, and this will give you a better idea about the condition of your heart. The third thing that gets affected is your kidneys. Now kidneys are like filter, so the holes are very small. Because of diabetes, the spores will start increasing in size and the proteins in your body will start leaking into the urine. But there will be no signs, no symptoms, no problems whatsoever. It is very simple again to diagnose this with a simple urine test called microalbumin, and if this is positive, that means your kidney damage is started and it can be reverted back to normal just with medications. A good control of diabetes as well as a good control of blood pressure will help your kidney a long way to run properly. By the time creatinine goes up, it means there is extensive damage in both your kidneys, and then it is difficult to bring it back to normal. However, it can still be controlled, but at the end of the story, probably you will end up in dialysis. So you have to start taking care of your kidneys right at the very beginning. The last is the nerves and the blood vessels. Now, the nerves of your feet are most commonly affected. So some people might have feelings like tingling, numbness, loss of sensation. There might be episodes where the chappal slips out and you don't realize it. There might be episodes where there is a small little ulcer or a small bite, but it doesn't pain. There can be loss of hair from your lower limb. All of this is a sign of nerves getting damaged. Secondly, the blood supply starts getting hampered. So this is more common in patients who smoke or who have tobacco usage. This will lead to development of small ulcers, and there is a higher risk of amputations in these patients. Every diabetes must check their sugars monthly, both fasting as well as postprandial, just to ensure that the sugars are well under control. An HbA1c, that is an average of the last 2 to 3 months, this test must be performed at least once in 6 months, if not 3 months. Annually, every diabetic patient must undergo a routine test to rule out any complications, including their eyes, including their heart, including their kidneys, as well as the blood supply to their feet and the blood supply and the nerve supply to their feet. So all of these tests are essential for every diabetic patient, and I cannot stress this enough, because diagnosed in the early stages, everything can be reversible to a large extent. However, the moment you wait for your symptoms to appear, it is already too late. Remember, diabetes is your life partner. It will not go away and there is no divorcing it. So you have to control your sugars well, and if you control them, then you can lead not only a long life but a very healthy life also. So please start taking care of your diabetes from today. If you have any other queries, you can contact me via Lybrate. Thank you.